Looking back, our EMR journey for healthcare clusters had been an extraordinary one. CPSS2 was not just any system for Synapxe. It was our foray into building Singapore's first EMR product and has been integral to both clusters care delivery and operations for more than 2 decades.
I recall sometime either in late 1998 or 1999 that the then CEO of NUH, Dr. Lim Swet Woon, personally came to my office, and both of us had this vision that we wanted to make the actual delivery of healthcare a lot safer and maybe improve the productivity within the healthcare system. And the idea essentially is, look Ben, can you try and develop an IT system then for National University Hospital that would try to achieve these aims of better safety, better legibility, better transmissibility, and the ability to locate information all in one location. So I would say that at the very start, what we had set out to try to achieve in terms of safer, faster, better usage and dispensing of medication largely had been achieved. So that was the tangible start with CPSS1.
CPSS1 gave us basic functions like how to build an electronic discharge summary. It gave us features on how to prescribe. CPSS2 expanded that capability to computerized patient order inquiry system. So we built a system to do labs, medications, inpatient as well as outpatient. The biggest challenge was, of course, adoption. Getting physicians who are so used to writing things on paper to abandon their pen and papers to go electronic. So I remember having running battles in the wards where I would have to steal away all the paper prescriptions in the wards so that they couldn't order for inpatient. In 2006, Singapore was trying to figure out how to procure an electronic medical record system. I think SingHealth had looked at their current Sunrise medical system. NUH was looking at a few systems. Sorin was one of them. And in fact, the impetus to build something was not really on the cards because it's a difficult journey to build your own electronic medical record system. But after a year, we realized that we had to take charge of our own destiny and build something that was meant to last and at least hold the whole healthcare system together at least for 10, if not 15 years of time.
There are a few projects in one's career that's difficult to forget. Being a part of KTPH's opening and being tasked as a young consultant to assist the landing of SCM, KTPH's EMR, is definitely one of those. The years that followed the opening of KTPH coincided with the growth of EMR across Singapore. At YH, we saw the extension of SCM from KTPH to YCH and later to ADMC. It was also a time of learning from across the world and learning more so from each other.
When we embarked on this journey, we had to bring people from many places, from the nurses, the operations, the doctors, from the very many specialty together to look at how we collectively work on the streamlining of the process. It was a big learning curve for a lot of people, but I think the spirit that everybody had was really taking on the challenge and never say die. And we had to quickly pick up the skill sets.
Well, when we had CPSS 1 and 2, it was fairly unique. It was bespoke. We developed them in-house. We are not a system integrator. We are not a vendor, a product vendor. And therefore our challenges is to put a team together to evolve the system and to keep the technology going. A lot of the IT folks had no healthcare background prior to this. And it was very helpful that we have a very supportive user group that we engage closely with, work with to help build this and own this together.
The transition's a really tricky one because people are very used to working in the current way of working. So there's probably 2 areas that we really focused in on. The first is getting the business users ready. We do big cutover activities, dry runs, to be able to preempt questions, to be able to get people prepared for day one. The second really is from the technology side. We have to get data out of all the legacy systems and all of the and work with all the teams that have participated to be able to make that transition as seamless as it can for the end user. It's a massive team effort. It's the legacy teams and the next-gen EMR team working together to support what the users need. And I think the benefits of next-gen EMR at a national level largely wouldn't have been realised without the work that's gone before us, laid by CPSS2, laid by SCM, laid by the pioneers that came before us.
The valuable lessons we picked up from CPSS2 have guided our next transformative stride into NGMR. These have been extremely useful as we forge ahead in the next chapter of our EMR journey to inspire tomorrow's health for our whole country. I would like to express my sincere gratitude to the leaders and healthcare providers for having Synapxe as your trusted technology partner. To my colleagues in Synapxe, a very big thank you and congratulations to all as we celebrate this milestone. I look forward to more in future to come.